Okay, so I think I'm going to say good afternoon, everyone, and thank you for being with us on Zoom today. Earlier this morning, I tabled Chapter 5 of my office's special report on COVID-19 preparedness and management, titled Pandemic Readiness and Response in Long-Term Care. As we all recognize, the COVID-19 pandemic has presented a challenge to health experts and government decision makers around the world. There is no doubt this pandemic has been unprecedented in its impact and complexity. Just last November, when I released the first 3 chapters of this special report, the new vaccines, which had been developed in record time, gave us hope that 2021 would be a better year. And while the new vaccines are making a real difference in our long-term care homes, let's not forget how grave the situation in these homes was last year. Despite very specific past observations and recommendations made by our office and others over the last decade on preparing for future SARS-like outbreaks, action taken over the years have been insufficient to ensure that we would be better prepared. Ontario's long-term care homes were among the first to suffer the impact of this lack of preparedness. As well, it's also important not to forget that the province has had long-standing issues in the long-term care sector. My office and others have been reporting on these issues and their impact on the care of seniors in long-term care homes for many years. Our work clearly confirmed that neither the Ministry of Long-Term Care nor the long-term care sector was sufficiently positioned, prepared, or equipped to respond to the pandemic in an expedient and effective way. Further, the long-term care home sector's lack of integration within the healthcare sector, compounded by the timing of the reorganization of the healthcare sector, did not enable long-term care homes to fully benefit from the needed life-saving expertise in infection and prevention control that could have been provided to a much greater extent by public health units and hospitals. In the course of our audit, we also noted the following. Long-term care homes were not required to prepare for a pandemic as part of this emergency planning. This despite the fact that the eventuality of a pandemic has been very clear to decision makers in Ontario since SARS. Regulation 7910 provides a list of emergencies they must prepare for, but a pandemic is not included on this list. Infection prevention and control measures were not consistently practiced, understood, or fully inspected in long-term care homes, even prior to the COVID-19 pandemic. This exacerbated the impact of a significant infectious virus on their residents. Direction from the Chief Medical Officer of Health to contain the spread of COVID-19 in long-term care homes was often unclear in the first wave of the pandemic and provided little guidance to them. Initially, that direction all too often left decisions to the long-term care home operators, and most of these operators did not have sufficient IPAC specialists in their homes. Crowding in homes was an issue. A lack of space prevented homes from isolating residents with COVID-19 effectively. Sorry, I'm just being asked to start my video now. Crowding was an issue. A lack of space prevented homes from isolating residents with COVID-19 effectively, but the province provided little guidance on what could be done, nor on off-site alternatives. Transfers of patients designated as alternative level of care continued from hospitals to long-term care homes, even though some of the homes were already at 98% bed capacity. Through the critical first 2 months during the first wave, the ministry did not conduct on-site inspections of homes because concerns about inspector safety were raised. Further, the ministry had decided in 2018 to discontinue proactive comprehensive inspections because they wanted to address a growing backlog of complaints and critical incident reports. And while non-compliance by homes with the Long-Term Care Homes Act and its regulation, including non-compliance with infection prevention requirements, has been a long-standing concern, the ministry has historically chosen not to implement fines and penalties. Our report contains 16 recommendations with 55 action items to address our audit findings. There should be no surprises in the content and recommendations in this report. Many of the issues and recommendations have either been highlighted or recommended previously by this office or were the subject of public discussions or publications among the various stakeholders we met with during our audit, as well as other interested groups and individuals. Proactively implementing the recommendations in this report in concert with similar recommendations likely contained in the upcoming report of the Long-Term Care COVID-19 Commission, would better prepare the ministry and the long-term care sector, not only for the impact of future disease outbreaks, but also for other significant and urgent care issues in the long-term care community. On a more positive note, in the last few months, as noted, vaccines have helped to significantly reduce COVID-19 outbreaks and deaths in long-term care homes. Furthermore, the province has committed to making a number of improvements in the long-term care sector. The implementation of these commitments and additional recommendations would go a long way toward ensuring seniors living in Ontario's long-term care homes are accorded the well-deserved dignity, safety, and comfort that is clearly envisioned in Section 1 of the Long-Term Care Homes Act. My office will be vigilant in following up on recommendations made in this report and will publicly report on whether the changes needed are actually made. And thank you for your time, and I'll now take your questions.
Hi, everyone. If you could just let me know in the chat your name and the outlet you represent, and then you can, I will call on you and unmute you when you've done that. Okay. Sorry, Bonnie, we're getting a number of questions, so I'm just going to take them in order. So the first will be Scott Lightfoot from CTV News. Scott, did you get the allow to talk?
I think he's still on mute because he's got the mute sign there.
Yeah, I've got asked to unmute.
I have to say, everyone, bear with us because this is the first time we've done a Zoom conference like this. So some new learnings for us.
Yeah.
And if we run into some difficulties and there are questions, just give me a call. My number is on the press release, and I can answer your questions on one-on-one if that works. Do you want to put the questions in the chat? And I can read the chat here and answer your question. Okay, I can read this out. Your report clearly indicates that no one was prepared. Your report clearly indicates that no one was prepared for a pandemic, but is it fair to say that the actions taken by the government, the ministry, the chief medical officer of health during the first wave actually made things worse in long-term care homes? These were actions that were supposed to help the situation, but from their overcrowding, from transfer patients, the lack of direction you note from the CMO, it really seems like these measures did the opposite of improving the situation. Would you say they made things worse? I would say that some decisions were taken that complicated the long-term care home's ability to deal with their residents during the pandemic. So, in terms of the capacity of the long-term care homes, transferring patients in did provide for crowding issues and made it more difficult to isolate residents. In terms of other issues that were the directives that were put forward were unclear based on the work that we did and what we heard. And so that caused people perhaps to make different decisions in different long-term care homes. So I would say there could have been more clarity and guidance provided by the CMOH, and the fact that there was more focus on the hospitals and moving people out the hospitals into the long-term care homes is probably now a learning that the safety of residents in the long-term care homes needs to be considered, and that isolating component needs to be better considered. So I would say that their actions inadvertently complicated things. The other one was moving, putting out the requirement that access of family members to the homes was pretty much eliminated. The difficulty there is a lot of family members would provide for the care that wouldn't have been able to be provided by the existing PSW staff, such as feeding residents, changing, bathing, etc., and helping with that. And so I think that was an unintended consequence, that the hands weren't there to help the residents that were in isolation and were in the home without enough PSWs. Okay, there's another question here. And the question is, sorry, just a sec. You noted in your report the change in the inspection regime with a reduction in comprehensive inspections over the past few years. How much of a role do you think that played in the devastation we saw in the long-term care homes during the pandemic? You know, I think we do think that there was an impact from that, in the sense that the inspections, those comprehensive inspections, were pointing out that there were IPAC weaknesses in the homes. And the inspectors were to be going and getting those corrected and following up. So during the year 2019, when there were no, you know, maybe a couple, but no real major proactive comprehensive inspections, they weren't highlighting that. So then we enter into the pandemic time, and those homes that perhaps could have benefited from some advice from those inspections didn't receive that advice. So they were even less prepared, as well as the ministry would have had less information as to how those homes would do with their IPAC during the pandemic. Then I have another question. What were the measures that were suggested after SARS that were not implemented? Basically, you know, the main one is the principle that you prepare and you be prepared for something like this and make decisions quicker. And so we do think that some of the decisions with respect to the long-term care homes could have been made quicker. There were also recommendations from the SARS Commission that spoke to expanding testing, you know, more coordination of the public health units. And those, although, you know, they're separate issues, they did impact the ability to test quickly in the long-term care homes, as well as the interface of the public health units with the long-term care homes with the health sector. So there are issues like that that were not addressed. Given that the government has failed to act on your previous reports, as you note, why can you be confident things will be different this time? Well, I guess I can be hopeful, and I feel confident in one respect. I did meet with the minister on this report, and we did have a very discussion, a long discussion on the report. And I do think there is intent on her part to make things right. I do think there are initiatives that have been undertaken that are moving us in the right direction with respect to seniors in long-term care. Obviously, I think there's more that can be done, and we have more recommendations on different areas. So, but I think the other difference is it's not just our office. I think there's a lot of attention from a lot of parties on this subject, which is what makes this even better. I think more attention and more, you know, let's not forget the impact that the long-term care homes experienced in areas where, you know, we would have thought they should have been better protected. And IPAC is infection prevention and control is important with or without a pandemic, because, you know, respiratory illnesses can contribute to the earlier death of people in long-term care homes. So I'm confident in the sense that there are more eyes on this, more people interested in ensuring the seniors are protected in the future. And I think a minister that has a passion for this area and is trying. I mean, I think, you know, there's a lot of systemic issues that need to be overcome, and there's a lot of players in this field that the discussions are happening with. So I think I want to say I'm cautiously optimistic that this will take a different route. And they are acting, or, you know, to be honest, in a lot of our other reports, there are actions being taken to implement our recommendations. So, you know, I do feel that that they are getting good attention. There's hit and misses, but generally getting good attention. Follow up to that, would you say it's likely the number of residents who died in long-term care during the pandemic would have been lower Had those actions you highlighted not been taken? Follow-up, would you say it's likely the number of residents not been taken? You know, I guess I don't have a crystal ball to look backward on. It sounds funny to look in the future, but to look actually backward and to say in a different scenario. But I do think that there is the crowding issue is one that experts have commented that had that not been the case, there might have been less of a mortality rate in the long-term care sector. So in that respect, that might have been one. We've heard when we followed on the commission's hearings, I mean, people did testify that you know, residents did pass from other issues other than COVID, malnutrition. And, you know, part of that does make you wonder if more hands there would have made a difference in the feeding of the residents. Okay, Mike Crawley, I'm not finding much significant in your report that hasn't already been reported before. What are you actually adding to our knowledge here? What's actually new? I would say that I think I acknowledge the fact that this report is pulling together a lot of information that is out in the public forum. I think the difference in what we're adding to this report is a number of specific recommendations that go a little bit deeper from the general discussion around the issues. And they're provided, and our report will be tabled in the legislature. The Standing Committee on Public Accounts can select this report, and they can have a hearing, and they can ask questions and make sure that recommendations are getting implemented. So I think that is another positive aspect of our process. We have a duty to report to all members of the Assembly and provide information that puts them on the same page. So a report pulls together a lot of information that can be captured in one document for discussion by the members themselves. I think, you know, in terms of what's new, I think we've clarified a few areas where there's been various discussions around, for instance, the inspection area. So I think we've added clarity there. Plus, I think we've added some information in terms of the conduct of the IPAC inspections, and added the discussion around who should actually be doing those in the long-term care homes. What we found is that likely the expertise resides in the public health units, not in the long-term inspection section of the ministry. And so there needs to be collaboration and working together. So I think, you know, it does not hurt to put more eyes on this. And I think we've added some value to this process and some recommendations that we'll definitely be following up and in the future and reporting on. And that's what we can do. That's our vehicle. And we can put it out through factual clearance as well with the stakeholders that have been involved in this area. Question, do you think the government mainly focused on hospitals and left long-term cares to fend for themselves at the beginning? I would say that at the beginning, there was concern that the hospitals would be hit the hardest, and there was the intent to move people out of the hospitals. The health command table as it started did not have long-term care representation on it. And then after, long-term care representation was part of the discussion. Who is to blame for this failure? You know, I think what we have here is we have a history of issues not being addressed in a timely way. And I think this COVID has just demonstrated the importance of making improvements when we know that improvements are needed in a sector like the long-term care sector. So I think, you know, if we look back, I think there's probably issues around why the recommendations weren't all implemented, why many recommendations around long-term care weren't implemented. You know, long-term care hasn't been, has sort of taken a backseat in the healthcare sector. And so I think there's a lot of, I think it's best now to look into the future and focus on what needs to be done to make this sector something we can be proud of as a province. I don't have any other questions that I can see. Are there any others? Do you think compliance can be improved without fines? This is a question I see here. I think, I think right now there's been what's called a supportive approach between the ministries and the Ministry of Long-Term Care and the long-term care homes in terms of trying to encourage compliance. I think at some point, more serious steps need to be taken. And I think consideration of fines is important. I mean, it's also important to recognize that there is a dependency of the province on long-term care homes to provide facilities. And so it's not as easy as suggesting that, that something can change what we're seeing quickly by implementing fines. But it does provide a deterrent, and it is another tool in a toolbox to try and encourage the long-term care homes to manage the homes in compliance with the legislation. I mean, ultimately, senior management in the long-term care homes are the ones that are responsible for protecting the people inside their homes. And so there needs to be some accountability on that front. In the terms of the RHRA, we did that audit last year, and we do see some action taken by the RHRA in terms of, replacing management in some of the retirement homes. So I've seen that question. Any others?
Okay, so Bonnie, I guess if we have no other questions, then I think that'll do it.
Oh, Anne, I see a follow-up. Just a follow-up, do you think there's accountability currently? I would say I think accountability needs to be increased. And I think it needs to be increased and demonstrated. And it's demonstrated by ensuring that the seniors in the homes will be cared for appropriately going forward. And so I would say we look at this going forward and ensure that there is an understanding that there will be consequences if there are problems that could have been managed better in the long-term care home sector. All right. So thank you, everybody, and I apologize for our glitches. We'll get to perfect this and hopefully see you online again. All right. So have a good afternoon. Thank you.